Good afternoon. I'm Stacy Wood, the Buncombe County Health and Human Services Public Information Officer. As a reminder, this community briefing will be streamed later on in Spanish on the Buncombe County Health and Human Services Facebook page at BCHHS. Today's community briefing for March 26, 2020 will seek to offer additional clarity on the questions that we've been getting about the Stay Safe, Stay Home declaration. Once again, we are joined by Dr. Jennifer Mullendore, Interim Public Health Director, and Fletcher Tove, the Public Health Preparedness Director.
Good afternoon. I'm Dr. Jennifer Mullendore, Buncombe County Interim Health Director. As of noon today, we have been notified of a total of 14 cases of lab-confirmed COVID-19 in Buncombe County residents and 5 cases in out-of-state travelers to our county. 11 of the 14 Buncombe County residents and all 5 of the out-of-state travelers that have had lab-confirmed COVID-19 have recovered from their illness and been released from isolation by Buncombe County Public Health. Since we've received some questions about this topic, I want to review the difference between isolation and quarantine. Isolation is when someone who is sick stays home and separates themselves from others as much as possible. Individuals with COVID-19 can be released from isolation when all 3 of the following conditions are met. First, it must be at least 7 days from the start of their illness. Second, they have not had a fever for 72 hours without taking medication to reduce their fever. And 3, their other symptoms, like cough, have improved. Quarantine is when someone is not sick, but has been exposed or been in close contact with someone who is sick, and they stay home for 14 days, checking themselves for symptoms of illness. And in the case of COVID-19, that's checking for fever and for cough or difficulty breathing. And again, in the case of COVID-19, close contact means within 6 feet of someone who is sick with COVID-19 for at least 10 minutes. We're also getting questions about testing of individuals in Buncombe County. And so Buncombe County Health and Human Services is aware of over 1,100 tests that have been conducted on Buncombe County residents since the start of this outbreak. And it's possible there are other tests that were conducted that weren't reported to us. In terms of testing that was done by Buncombe County Health and Human Services staff or at the county community testing sites, around 100 test results are still pending. And again, Buncombe County Public Health is informed of all positive COVID-19 test results on Buncombe County residents or travelers who are located in Buncombe County. Many of the people who have been diagnosed with COVID-19 in Buncombe County have had mild illness and recovered quickly, and we are very thankful for that. But I want everyone to understand how serious this illness can be. I think most of us are seeing what's going on in New York City right now, in New York State. And if you pay attention to the news from there, you know how serious this can be and how many people end up in the hospital or can die from this illness. So we want everyone to take it seriously and to understand that the guidance that we're giving you and the steps that we have taken are to protect you and everyone in our community, including those at highest risk. And I know that watching what's going on in New York can seem like it's happening on another planet. It seems distant, but it's real. And everything we're trying to do is to keep that from happening locally. So again, please stay home if you're sick. Call your healthcare provider if you have concerns, especially if you're a high-risk individual. So if you're over the age of 65, if you have an underlying health condition, so especially lung disease, heart disease, diabetes, a weakened immune system, or if you're pregnant. And all of us, stay home, stay with the people that you already live with to the extent possible. Wash your hands frequently. Do everything you can to keep yourself from getting exposed and from exposing anyone else to illness. And again, I will refer you to a document that is found on our Buncombe County website that talks about what you should do if you feel sick. It provides all the information you need to guide your decisions about when to call your healthcare provider, what to do if you have symptoms of COVID-19. It goes over the information about when you can release yourself from isolation if you have symptoms of COVID-19, and what your family members should do. And if you have any further questions, again, look at our buncombeready.org website. Go to the state's COVID-19 website or the CDC website. Thank you. I'm going to turn it over to Fletcher Tove now.
Good afternoon. I'm Fletcher Tove, Buncombe County Public Health Emergency Preparedness Director. The supplemental declaration that Chairman Newman signed yesterday goes into effect tonight at 8 p.m. That declaration and the accompanying interpretive guidance are available on buncombecounty.org. I'm going to spend my time today addressing several questions we've received over the last 24 hours. But first, I want to preface that by painting a bigger picture of what we're trying to accomplish. We've seen many questions from people and businesses about the designation of essential versus non-essential. And that's important, and we're glad to see that so many people are paying attention and taking this seriously. But the bigger picture is that we're trying to create a county-wide partnership to slow the spread of COVID-19 by distancing people. We as public health cannot account for every possible business in the county and analyze all of the gray areas. So we're asking you, the citizens, residents, and business owners in Buncombe County to help us. Step back, look at the intent, look at the bigger picture. The intent is to keep as many people as home as possible for the next 2 weeks, and to ensure that any opportunity for close contact with another person is reduced as much as possible. We don't have a vaccine for COVID-19, so this distancing is our best tool right now to protect ourselves. As Dr. Mullendorf mentioned, a quarantine period for an individual is 2 weeks. We set this declaration to last for 2 weeks to essentially quarantine the county. The bigger picture is that we're trying to protect our most vulnerable, our grandparents, our best friend's grandparents, our coworker with diabetes, the kid down the street with asthma. So please keep that in mind as I address these questions. Has the county received many requests from businesses asking for waivers, and how is that being handled? Yes. Overnight, we've received over 600 requests, and they continue to come in, and we're doing our best to address those as quickly as possible. Most of these questions we're seeing for businesses have already been clearly identified and defined in either the declaration or the interpretive document as essential. So I encourage anyone who has a request pending to take a look at the declaration and the interpretive guidance on our website and see if you are deemed essential. If you are deemed essential through those documents, you don't need any letter or justification from Buncombe County. You default into essential status. If you are not covered as essential in that guidance, but feel that your business should be, that's when we're asking you to send an email to business@buncombecounty.org so that we can determine if you qualify. That's business@buncombecounty.org. Those businesses will receive a document from the county that deems them as essential if they are approved. Many of the questions we're receiving are from the same industry, so we're going to try to address those bigger groups through these press availabilities to take some of the burden off of our email response. Another question: do essential workers need credentials or passes for travel and transit in Buncombe County? No. Currently, Buncombe County is not taking any actions to disrupt transit or roads. We are only asking people to limit their travel to essential travel only. At this time, essential personnel and businesses do not need any form of credential or pass to be on the roads. We're seeing a lot of comments off of social media about the county establishing checkpoints or roadblocks, and I want to assure you that none of that is happening. You will not be pulled over to determine if you are essential or not. If you are getting pulled over, it's probably because you're speeding. The bottom line is that if you don't have an urgent or pressing need to be out, you need to be at home. Another question: when was this decision made, and was it a necessary step for the community, for the county? So in a sense, the decision to issue this declaration was made months ago when we first started discussing our strategy to limit the spread of COVID-19 in Buncombe County. We've always known that social distancing, keeping our distance from others, is one of the most powerful tools in combating the spread of any contagious disease. So we've always had as part of our planning to ramp up our social distancing measures as the threat of COVID-19 increases. We had established several triggers to determine our level of response, and as we've met those triggers, we've responded in accordance with our strategic plan. Some of the triggers that set into motion our stay home, stay safe declaration were documented community spread in Western North Carolina, a jump in positive cases in Buncombe County, and a percentage of the community not taking the threat seriously and not complying with guidance from public health. Another question: are ABC stores considered essential retail? Yes, ABC stores are considered essential retail. You're welcome. Are credit unions considered essential? Yes, credit unions fall under the category of financial institutions and are deemed essential. Are lawn care companies considered essential? No. Lawn care service is not deemed essential for the next 2 weeks. If an individual wants to go out and help an elderly neighbor and mow their yard, that's great and encouraged, and it's allowed for in our supporting a friend and neighbor clause. But larger lawn care companies should not be operating and putting multiple people into a cab of a truck. That's not acceptable right now. We are aware and have read a letter from the CEO of the National Association of Landscape Professionals. And we understand he is trying to protect the livelihood of workers in his industry. However, we are trying to protect and safeguard public safety and health. So we have deemed lawn care services as non-essential for the next 2 weeks. Is realty considered essential? Aspects of real estate are considered essential, particularly appraisals and any paperwork or closings that were in progress prior to this declaration. However, realtors should show houses virtually and should avoid doing in-person showings for the next 2 weeks. There is opportunity through the minimum business operations clause to have a single individual update that inventory so they can continue to show those houses virtually. Is construction and development essential? Residential and commercial construction activities are included in the essential critical infrastructure exemption, but it's important for those workers to maintain social distancing and comply with public health guidance. They shouldn't be sharing trucks going to and from the job site, and they should be wary during times such as lunch, being in close proximity to another. Are building, construction materials, and manufacturing sectors considered essential? Yes. Retail, including hardware stores, and the production and manufacturing of building and construction materials are deemed essential and are included in subsections 3 and 4 of the Declaration. But again, it is critical for these workers to observe social distancing and public health guidance. Is transportation and logistics considered essential? Yes. Businesses that manufacture, repair, or supply parts and materials that are necessary to supply and maintain transportation and business lines of communication and other logistical services are deemed essential. How does this apply to people like house cleaners, babysitters, and nannies who go into other people's homes for work? So babysitters, nannies, and cleaners are deemed essential under this declaration. They meet child care needs, and they fall under our caring and supporting a friend and neighbor clause. However, it is up to the individual to determine if having someone come into your home is safe. You need to consider if you understand what those service providers are exposed to. How many homes are they going into a week? Who is in and out of their homes? Do you have high-risk individuals in your life? Are you willing to risk your grandmother or niece because you wanted house cleaning over the next 2 weeks? One more question. I live in Buncombe County, but I work in a neighboring county. Am I allowed to go to work? Yes. Buncombe County does not have the authority to regulate employment activities outside of Buncombe County. While we encourage everyone to stay home to the greatest extent possible and to stay safe, residents of Buncombe County who are employed outside the county may travel to work regardless of the nature of their occupation and whether or not that would be defined as essential under the Buncombe County Declaration. One final note, as this declaration goes into effect tonight, grocery stores will remain open, as will convenience stores. Going to the grocery store is deemed essential, but we do ask you to plan ahead and limit those trips to the grocery stores. So again, there's no need for everyone to make a run on the grocery stores and conduct panic buying and clean the stocks of fresh meat, toilet paper, and other essentials. When you do that, in a sense, you are taking from people who maybe do not have the means to buy ahead or the opportunities and schedules that allow them to keep up with that panic buying. So please, when you go out to the stores and stock up for this period, do so responsibly and not excessively. Thank you.
We understand that the community has many questions about the COVID-19 response in Buncombe County. Heading into week 3 of the COVID-19 response, we are working to develop a routine that allows us to sustain our ability to provide updates to our community, ongoing and for a long time. This is a marathon, not a sprint. Here is what the community can expect from the Emergency Operations Center, or the EOC, regarding COVID-19 community updates starting this weekend and beginning the week of March 30th, and that's this coming Monday. There are no community updates from the EOC scheduled for this weekend. Mondays and Thursdays at 2:30 p.m., we will continue to offer community briefings via Facebook Live on the Buncombe County Government Facebook page. Information such as case counts will be posted by 2:30 p.m. on weekdays on Buncombe County's government page, COVID-19 webpage, and that's buncombecounty.org. In the event that there are changes to Buncombe's state of emergency declaration, the community will be notified through all available communication channels. We advise the public to visit buncombecounty.org for accurate information on COVID-19 in Buncombe County. Our goal is to make sure that all members of our community have the information that they need to be safe during this pandemic. This is a fast-moving situation, and we are working diligently to respond to the high volume of questions coming into the EOC. This speaks to the desire of our community to protect our most vulnerable members, and we appreciate your patience and understanding as we navigate these unprecedented times as one Buncombe.